Thank you for joining us tonight. We are looking into the economic impact the coronavirus is having on Madison. We'll have an update from the Greater Madison Chamber of Commerce.
And the latest statistics on coronavirus in Wisconsin. But first, public health officials say there has been a spike in overdoses in the past few weeks. Save Communities launched a 24/7 hotline a week ago and say while overdoses have increased, they're also receiving a greater number of calls from those reaching out for help. Jamie Perez spoke with them about what the conversation sounds like when people call that hotline and how they've been helping combat the issue. Jamie?
So this is kind of a double-edged sword, right? On one side, you have more people who are overdosing, but on the other side, you have more people who are also reaching out for help. And this is exactly why Safe Communities started their hotline.
Unfortunately, she was very close to me, and she was in recovery, and she experienced a relapse, and she passed away. She was really involved in all of our events and our, end overdose campaign that we do in August, and she was always there and helping. So it's really tough.
Kristina Vaccaro is a recovery coach supervisor with Safe Communities. Her friend Jenny overdosed after being in recovery for several years. Whether her breaking point had anything to do with the feeling of isolation in the world right now, we will never know.
Members of our community, young members of our community who have so much value and are people's family members and friends, and it's heartbreaking.
But the one thing we do know is that what is happening in the world is impacting many people in recovery and those who are currently using. Safe Communities launched a hotline to help.
Since you've launched it, have you seen an uptick in the number of calls that you're getting?
Definitely.
Renee Simon is one of several recovery coaches who has been answering those calls. Simon is in long-term recovery from cocaine and opiates and knows what this loneliness and isolation feels like. So when she answers those calls.
So my job isn't to talk somebody out of using at any given moment. My job is to offer them hope and the possibility that they can stop using if they want to. You don't want anybody hanging up that phone without at least feeling like they've had a chance to connect with a person who's in recovery, who understands what they're going through.
With the chance of hope on the other end, they're seeing a silver lining as more people become aware that the hotline is there to help.
When we see an increase in opioid deaths, we definitely are grateful to be seeing an uptick in calls because we are able to help those people not end up a statistic.
They expect to see more people using their hotline as time goes on, and they're hopeful that they can help save lives with the more people that do call.
All right.